Good day, future RMTs. In this discussion, we are going to discuss AIDS Prevention and Control Act of 1998. Our learning outcomes are as follows. Recall the provisions of RA 8504 in relation to the practice of the profession and analyze legal issues and concerns related to the law. To start with, I would like you to know what is an HIV. HIV is a single-stranded envelope virus from the family of retrovirus or retroviridae, which is the causative agent of what we call acquired immunodeficiency syndrome or AIDS. Take note, guys, that HIV infects the CD4 T helper cells of our immune system that makes our immune system weak, which can lead into immunodeficiency syndromes or problem in the immune system can lead into what we call the weak immune system. Now, there are three enzymes within the viral load or within the viron of our HIV, which are all important on its replication. We have your reverse transcriptase enzyme, which is the virus transcription of DNA, of RNA to DNA. We have the integrase, which used to penetrate the target cells in the body. And we have the protease, which is for the maturation of the virus. I would like you to remember also that GP120 and GP41 are the important glycoproteins of our HIV. Okay. Remember that modes of transmission and symptoms of HIV includes the most common one is the unprotected sex intercourse with infected partner. Later, as we discuss the law, there is a provision in the law that requires, that mandates that you should be transparent in terms of your sexual activities and sexual status to your spouse, to your husband, to your wife, and even in your sexual partner as described and written in the law. This is the most common, but it is not limited to this one because vertical transmission is also possible from mother to child during the delivery. Okay, and there is also possibility that you might get the infection through injection of drug use, or if you are sharing needles, or through blood products such as red cells or plasma. However, there's a rare conditions or rare instances that HIV is acquired from those conditions because blood is being screened against HIV virus or HIV, immunodeficiency virus. I'm sorry for HIV virus against HIV. Remember, guys, no, as I keep on telling, na HIV is a fragile virus. Once that it is outside the host, once that it is outside the body of the host, no, it is easily destroyed. That's why immediately requires host where it can replicate its viral load. Remember that semen, vaginal fluid, blood, and breast milk are all carriers of the viral load. However, tears, sweat, feces, and urine are all body fluids that may contain the viral loads of your HIV but not capable enough to cause an infection. Take note that HIV is not transmitted through insect bite. This is not a vector borne. Toilet sits, kissing, sharing toiletries, and touching. These are not all mode of transmission. Remember also that living with person with HIV does not will not cause you to have HIV. Remember that these are ethical issues, moral issues of life because most of person with HIV is being discriminated or being discriminated because of their health status. This is a sensitive and issue. No, this is a sensitive issue that needs uh, personal, acceptance, personal uh, way on how are you going to handle the situation. It does not require social attention. If you have this, no, you have to be the first thing that you have to do is to admit that you have this in order for you to uh, survive. Okay. Beneficence and justice is also the moral issues of HIV. Why? Because discrimination, no injustices happen during discrimination. And lastly, respect for others should always be maintained, whether you are an HIV positive or you are an HIV negative. In terms of laboratory procedures, now we have to make sure that there is a confidentiality of laboratory results. Okay? You should not, you should not uh, make the results of your patient publicly because you will be penalized under the law. Now, this is an example of a laboratory result being shown by the patient who had his or her laboratory diagnosis or laboratory test for HIV. As you can see in the remarks, please provide post-test counseling. Okay. Now, in the recent uh, data that I gathered, from the Department of Health through the HIV/AIDS and STI surveillance and strategic information unit, the Philippines, had 257 newly diagnosed cases in the year 2020 for the month of April. This is just for the month of April. However, guys, since 2020 is the time that the COVID-19 pandemic started, hindi po natin masyadong natutukan or wala masyadong data about this. Okay? But considering that this is the data, 257 for that month only, and 77,882 individuals have been diagnosed with HIV since 1984. That is based on the report of the National HIV/AIDS and STI Surveillance. Take note, guys, that most of the HIV positive are men. 94% are men, accounting to 73,092 individuals. Okay? And only 4,779 female. This is just male and female, but we don't have the data. I don't have, if you are going to look on the data per age, you will be shocked that even a youngest person in the world can have a, HIV. If her or his mother is an HIV positive, there's a possibility because what you call it, vertical transmission is possible. So now please allow me to discuss what is Republic Act 8504. Take note that Republic Act 8504 is an act promulgating policies and prescribing measures for the prevention and control of HIV/AIDS in the Philippines, instituting a nationwide HIV/AIDS program, establishing a comprehensive HIV/AIDS monitoring system, strengthening the Filipino National AIDS Council or the Philippine National AIDS Council, and for the other purposes. There are more than 50 sections in this law, but I'm going to skip some because those are self-explanatory. And I'm going to give emphasis on the things that you have to remember, that you have to take note. To start with, Section 2 declares the principles why we have this law. The state shall promote public awareness about HIV and AIDS. Promote public awareness. When COVID-19 comes in the Philippines in the year 2020, no, not only in the Philippines, but when the WHO declared the pandemic status of COVID-19, everything has changed. Everything has changed in this world. Education, livelihood, the way how government works, the way how the private sector works, the tourism industry, everything has been changed. We are forced to stay at school at home. Okay, we are forced to stay at home to prevent the spread of COVID-19. But take note, guys, HIV is can be considered as a global pandemic also. This is a health issue also, which is an important health issue. No, that's why if you are going to browse social medias, no, there's a one I just forgot if I saw it in Facebook or in TikTok, wherein the COVID-19 virus is being bashed by the different by other viruses, including HIV, because HIV becomes a globally recognized viral infection. In fact, it can be considered pandemic. Bakit? Kasi mataas din ang cases, no? But the COVID-19 changed everything. However, giving an emphasis on what we're going to discuss this day, take note that this virus, that this condition should be promoted. Or what do I mean promoted? The state shall promote awareness about this virus so that the people will be knowledgeable about this virus. The state shall also extend every person the full protection of human and civil rights. Whether you are infected or not, you should have the full protection of your human and civil rights, including compulsory HIV testing. That is unlawful. Okay? Rights of privacy of individuals with HIV. If you don't want na ma-expose, sabihin sa lahat, you have the rights. You have the rights to keep it on yourself. You have the rights to keep it on your family or someone you want to know. Hindi yung ipapublicize natin. Juan de la Cruz, HIV positive. For what? No? Privacy. Discrimination in all forms, in school, in workplace, in religious belief, or whatever it is. Provision of basic health and social services. If you are positive, it doesn't mean you are a less person. If you are HIV positive, you should what you call this? Experience the same services, basic health services and social services that someone is being experienced or the experience ng someone. Okay? The state shall promote utmost safety, universal precaution. And lastly, to recognize the potential role of infected individuals in propagating vital information. However, I am sad to say that there are some people who are HIV positive who became not part, no? Hindi sila naging vital in the information. Sila pa yung nagsasabi that they don't believe on HIV. Section 3 of the law defines the terms being used in the law. Okay? But I will not discuss everything because those are self-explanatory. I will just give emphasis on this definition of terms. Number one, we have your compulsory HIV testing. What does it mean? It refers to HIV testing imposed upon person attended or characterized by lack of violated consent, use of physical force, intimidation, or in any form of compulsion. When I was still working in the hospital, all pregnant, no, should be subjected for HIV. Nagtataka ako bakit. Why they have to? The law says, the law says, hindi naman dapat compulsory yun. Pero bakit? For the safety. Not only for the safety of the health workers, but also for the safety of the mother, for easy detection. No? Contact tracing. Tracing, no? Contact tracing refers to the method of finding and counseling the sexual partners of a person who has been diagnosed as sexually transmitted disease. Later, as we discuss, no, I will show you the consent form and the interview sheet para malaman nyo kung bakit mayroong contact tracing. Informed consent, it is important. It refers to voluntary agreement of a person to undergo or to be subjected to a procedure based on the full information. Take note, not all Filipinos are required to undergo HIV testing, but encourage. Okay? Medical confidentiality will, of course, since this we are medical workers, you are the future medical workers. You have to take note that medical confidentiality must be maintained at all times. What do we mean by that? It refers to the relationship of trust and confidence created or existing between the patient and the person with HIV and his attending physician, medical specialist, medical technologists, nurse, and other healthcare workers. Pre-test counseling refers to the process of providing an information to on the biomedical aspects of HIV and emotional support to any psychological implications. We have what we call HIV counselors, and I was given a chance to participate, you know, and conduct HIV counseling. Post-testing or post-test counseling is refers to the process of providing risk reduction information and emotional support to the person who submitted to HIV testing at the time that the result is released. Most especially if the result is positive. Okay. Sometimes in hospital, they call it as GAD, Gender and Development Center. Okay. And then prophylactic is refers to the any drug or devices used to prevent the transmission of the disease. Like what I've said, no, there is no cure yet for HIV. However, no retroviral ay ibinibigay to uh, prevent the s- the spread of the virus. Okay? But recent study shows a promising effect, a promising result of a vaccine being developed for HIV. Now, this law, R88504, is divided into articles. Article 1 is all about education and information. Section 4 of Section 4, Article 1 of the law is all about HIV/AIDS education in schools. Take note, guys, that the CHED, DepEd, and TESTA shall educate students regarding the causes, mode of transmission, and the way how to prevent HIV and AIDS. HIV and other STIs are sexually transmitted disease. Take note, no, sa atin kasi in our field, it is acceptable that it will be coming from us, who are healthcare provider, who are knowledgeable enough to discuss the mode of transmission, the cause, and everything about HIV. But how about for those who are not inclined in the medical field? Let's say, for example, since the law states that teachers, no, the in-depth ed shall do, shall perform this, shall perform the education campaign. Take note that uh, they must undergo trainings and seminar on HIV prevention to be supervised, of course, by CHED, by DepEd, and of course, in coordination to the Department of Health. Section 7 is all about the AIDS or HIV/AIDS education for Filipinos going to abroad. Take note, guys, that all Filipinos going abroad or overseas Filipino workers or OFW and diplomatic, military, trade, and labor officials and personnel to be assigned overseas shall undergo or attend seminar on the cause, prevention, and consequences of HIV before certification of overseas assignment. Sometimes, madalas yung mga seaman, okay? And meron din silang HIV testing. Di naman nire-require pero ina-encourage sila na mag-HIV testing, lalong-lalo na for their health card. I don't know why companies abroad are requiring Filipinos to have a negative HIV result. Is it is it covered by the law? Eh, abroad yun eh. The Republic Act shall only be uh, valid within the territorial boundaries of the Philippines. Section 11 is all about the penalties for misleading information. Ano ito? Imprisonment for 2 months to 2 years without prejudice. Okay? Furthering suspension or revocation of the license of the professional or of the business if there is a misleading information about HIV and AIDS. Article 2 is all about safety practices and procedures. Definitely, no, as you all know, all blood should be screened for HIV prior to the blood transfusion. Kaya nga tayo ay mayroong screening. Why? To ensure that we will not be able to transmit the virus. Alangan naman nasagot nga natin ang problema niya in terms of blood loss. Binigyan naman natin siya ng panibagong problema. It shouldn't be like that. Take note also that all laboratories accepting tissues and organs for donation shall accept the organ only if and only if The person who died is a negative in HIV. Section 13 is all about surgical guidelines on surgical and similar procedures. Okay. Uh, Guidelines on precautions against HIV transmission during surgical, dental embalming, tattooing, and similar procedures should be uh, implemented. No? The DOH shall likewise issue guidelines on handling and disposition of the cadavers by the fluids or waste of human person to be believed to have an HIV. Okay, well, of course, personal protective equipment is important. Section 14 is all about the penalties of unsafe practices and procedures. Any person who knowingly neglect or neglectly cause another to get infected might be uh, imprisoned for 6 years to 12 years, or his or her license may be cancelled or withdrawn. Okay? Article 3 is all about testing, counseling, and screening. Take note, guys, that a consent as a requisite for HIV testing is recommended. Later, I'm going to show to you. Okay? Most especially sa mga taong ito, a person volunteers or freely agrees to donate his or her organ, blood, or tissue for transfusion, transplantation, and research must undergo HIV testing. Ito, required talaga sila. A person who a person has executed a legacy in accordance to Section 3 of Republic Act 7170 or the Organ Donation Act of 1991, which we are going to discuss in these coming days. A donation is executed in accordance to Section 4 of Republic Act number 7170. Take note, if you are going to donate your organ, you have or blood, kailangan ka magpa-test for HIV. For blood, kasama na yun dun sa testing. Wala yung bayad. Pwede mo pang malaman if you are an HIV positive or not. At least for free. Okay? Section 16 is all about the provisions of the compulsory of HIV. It is unlawful to require, to ask, to mandate people to have an HIV test prior to employment. Hindi po yun katanggap-tanggap. That is against the law. Admission to educational institution. You, as a medical technologist, we cannot ask you to have your HIV test. And if you are positive, we will not accept you. It is unlawful. Exercise of freedom of adobe, no right to travel, and provisions of the medical services or any kind of services. You should have the same. Yun nga lang, ang tanong ko kanina, no, bakit yung mga buntis, bakit kailangan mayroon pa rin sila? Hindi kaya yun unlawful because of the medical services? Kasi dito, sabi, unlawful, provision of medical services or any kind of service. That's a legal issue and at the same time, a moral issue that you have to answer. Okay? Section 20 is all about the pre-test and post-test counseling. Take note, guys, that the center, clinics, and laboratories performing HIV testing must provide or shall provide and conduct pre-test and post-testing counseling. So, paano po yun? Like what I've said, this is the informed consent form from DOH regarding HIV testing. Ano yung nakasulat dito? Allow me to read. The Department of Health has an existing program for the prevention and control of human immunodeficiency virus in the Philippines. The National Epidemiological Center, or NEC, of the Department of Health is mandated by Republic Act 8504 to collect information which can help in planning activities which will help halt the spread of HIV and beneficial to the people. Your full cooperation is very important to undertake this activity. We encourage you to answer all questions as honestly as possible. About test. What is HIV testing? An HIV test is a blood test. It will show you if you have antibodies to HIV, the virus that causes AIDS. Okay? Ang sabi pa dito, You need to be retested after 3 to 6 months to make sure that you are not infected. Bakit? Kasi may window period po tayong tinatawag. Voluntary HIV testing. Taking an HIV test is voluntary under Republic Act 8504. It is not compulsory, but voluntary. You cannot be tested without your knowledge or consent. If you don't want to be tested, you have the rights to refuse the test. Confidentiality of the test result. Your test result is confidential. No, it will only be given to you personally. Ano yung nakalagay dito? I was given information about HIV and HIV testing and was given the opportunity to ask questions during pre-test counseling or group test information. I agree to be tested for HIV. The name of the patient, the signature, and the date. Now, how about if the patient is minor? E di dapat mayroong informed consent from the parent. Okay, ito po yung mga tanong. Number one is the PhilHealth number, if you know, no? And then your full name, okay? Mother's maiden full name, a full real name, no? Question one is, this is just the first two letters of the mother's real name, okay? And the first two letters of the father's real name for coding, no? Unique identifier code. Your birth order, pang ilan ka sa magkakapatid, birth month, birthday, and birth year. Ayan, that will be your unique identification code. The age, months, no? Your sex at birth. Now, permanent address is also important. Contact number for post counseling or for post counseling and email if you want to the result to be sent to your email. Nationality, highest occasional attainment, civil status. Are you living with a partner? Yes or no. Number of children, if you have. Are you presently pregnant? Well, of course, for females only. Okay. This is about the demographic data and the unique identifier of the patient. The next question is employment. Current implication of occupation. No, are you working on overseas or abroad in the past 5 years? Kasi baka doon mo nakuha if ever na mag-positive. If yes, when did you return from your last contact? Okay, contract. Were you based on ship or land? Okay, what country? Those are important questions. Ito na. Yung mga reasons why you are having your HIV test. Okay? Reasons for HIV testing: mother is infected, sex partner is infected, shared needles, accidental needle prick, recommended by physician, requirement for insurance. No, hindi ko alam kung ba. There's also a question for in my mind. Why? Receive blood transfusion, wants to know HIV status, recheck, employment, local in the Philippines, or hindi dapat, no? Employment overseas, pregnant, TB patient, active hepatitis B or C, no particular reasons or others if you have. Next, history of exposure. These are all important questions that a person must answer. Like what I've said, I was given a chance to do this counseling. Later, I will tell you a short story. Okay. Receive blood transfusion, kung yes, kailan. Injected drugs without doctor's advice, kung yes, kailan. Accidental needle prick, yes, kung ilan. And then, what year pala? I'm sorry. Anong kung ilan? Kung kailan? Sex with a female with no condom, yes. In what year? Sex with a male with no condom, yes. On what year? Sex with a person in prostitution, yes. In what year? Regularly accept payment for sex, yes. If, and then, what year? If no, edi no, wala nang year na sunod. Okay? Now, if both, answer both. If none, then write zero in the box. How many female sex partners you ever had? Right. Ilan? How many male sex partners you ever had? Okay. Last year. Bakit kailangan ito? For contact tracing nga eh. Okay. for contact tracing. Dito ako nagugulat sa part na ito, 'pag nagka-counsel. Medyo surprisingly ang mga numbers, even the age nakaka-surprise, okey? So this is the resulting. Have you ever been tested for HIV? Kung yes, kung kailan, and then no kung hindi. Clinical picture kung ikaw ba ay asymptomatic or asymptomatic. It will be, filled out by physician, clinic staff, or the counselor, okay? And this will be, to be filled up by testing facility only, okay? For the documentation. And as you can see here, number 22, name of medical technologist, HIV proficient number, and then the date of issue. So for Article 4, health and support services, Article 5 is monitoring, Article 6 is confidentiality. And one of the most important things in Article 6 is the Section 32, which is all about the release of HIV and AIDS test. Kanino lang pwede siyang i-release? To the person, him or herself, either parent of a minor child, a legal guardian in case insane person or orphans, a person authorized to receive results in conjunction with the AIDS Watch program as provided in Section 27 of this Act. Okay? A justice of a court of appeals or Supreme Court as provided under subsection C of this Act in accordance with the provision of Section 16 hereof. So sila lang yung pwedeng makakuha ng resulta mo, ng result. Ikaw mismo, magulang mo if you're minor, your guardian if you are insane person or orphan. Now, Section 33, paano pag na-violate ang confidentiality? You can be imprisoned for 6 months to 4 years. No suspension and revocation of the license. If you are a medical technologist at hindi mo na-ensure on confidentiality, your license might be revoked or suspended. And of course, cancellation or withdrawal of the license to operate of any business, including laboratory. Now question, is it acceptable, like what I was telling a while ago, is it acceptable if an HIV positive individual did not disclose his or her status to his sexual partners? If your answer is yes, you are wrong. You have to disclose your sexual status to your partner, to your wife, to your husband, as written in the law. No? Any person with HIV is obliged to disclose his or her HIV status and health condition to his or her spouse or sexual partner at the earliest opportunity. Time. Take note of that. Yes, you have the rights to your confidentiality, but for the welfare of your partner, you have to disclose. And that is required under the law. Now, Section 7 is all about the discriminatory acts and policies. So, dapat walang discrimination sa workplace. Hindi ka dapat hingan ng HIV result prior to employment. Well, of course, in school, travel and habitation, public services, no? Hindi ka pwedeng sumakay ng MRT or LRT kapag ikaw ay HIV positive. Hindi naman natatama yon. Okay? Discrimination in hospitals and mental institutions. We're not accepting HIV patient. Go away. It is not acceptable. No, discriminatory yan. Denial of burial services. Ito yung nakakatawa pero sana walang nangyayaring ganito na kapag HIV ka, hindi ka pwedeng ilibing. Ayun, di ba? Um, each person has the rights to have the same, to treat the same, whether you are HIV positive or not. Now, what are the penalties if someone revoke this? Penalty of imprisonment for 6 months to 4 years. Fine that is not exceeding 10,000. If the discrimination happens in schools or in any institutions or hospitals, aba, teka lang. We have to visit your license. we have to revoke that because discrimination should not happen to person with HIV. Section or Articles 8 is all about the Philippine AIDS Council, no? And this is the logo of the Philippine AIDS Council. This council is founded in response to raising cases of HIV AIDS in the Philippines. This was signed in the year 1992 by Executive Order number 39. Okay? And under the law, under 8504, sinabi doon, what are the functions, duties, and responsibilities of the PNAC, or the Philippine National AIDS Council. One of the most important thing that I want you to take note is that the PNAC should develop comprehensive long-term national HIV/AIDS prevention and control program. It's one of their functions. Okay, the PNAC works with these government authorities. Okay, and lastly, these are the concluding parts or the miscellaneous provisions of the law, the implementing rules and regulations, the separability clause, the repealing clause, and the effectivity. Take note that this law was approved a day before Valentine's Day on February 13, 1988. 1998 rather. Once again, thank you very much and God bless you all.